Welcome to Calm Mind and Healthy Body, our channel. In today's video, we're diving into a crucial health topic that affects many people. The 8 critical signs of blood clots. Blood clots can be life-threatening if not recognized and treated promptly, so understanding the symptoms is essential for everyone. We'll explore each sign in detail, helping you identify potential warning signals in your body. Our goal is to equip you with the knowledge you need to take action if you or someone you know experiences these symptoms. By the end of this video, you'll better understand how to recognize blood clots and the importance of seeking medical attention. So let's get started and empower ourselves with this vital information. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. Sign 1. Swelling in one leg. Swelling in one leg can be a significant indicator of a blood clot, particularly in the deep veins, a condition known as deep vein thrombosis, DVT. Unlike normal swelling, which may occur due to minor injuries or prolonged standing, swelling caused by a clot often appears suddenly and is usually accompanied by pain or tenderness. Paying attention to this symptom is essential, as it can lead to serious complications if left untreated. If you notice swelling in one leg that seems unusual or is accompanied by other symptoms, don't hesitate to seek medical attention. Early detection is key to preventing more severe health issues, so stay vigilant and prioritize your well-being. Sign 2. Pain or tenderness. Pain or tenderness in the leg can be a critical warning sign of a blood clot. This pain often feels different from typical muscle soreness. It may be sharp, throbbing, or accompanied by a heaviness in the affected area. While muscle pain usually arises from overexertion or strain, pain from a clot is often localized and may worsen with movement or pressure. It's essential to monitor any persistent pain, especially if it doesn't improve with rest or is accompanied by swelling. If you experience this discomfort, don't ignore it. Consult a doctor promptly. Early intervention can significantly affect your health, so stay proactive about your symptoms. Sign 3. Red or discolored skin. Noticing red or discolored skin around the affected area is a vital sign that could indicate inflammation or a blood clot. This discoloration often appears as a reddish or bluish hue and may be accompanied by warmth in the area. Look for changes such as a patch of skin that feels different in color compared to the surrounding areas or any unusual streaks. These signs can suggest that a clot is blocking blood flow, leading to potential complications. If you observe any skin discoloration along with other symptoms, it's crucial to seek immediate medical evaluation. Prompt attention can help prevent serious health issues, so don't hesitate to contact a healthcare professional if you notice these changes. Sign 4. Warmth in the affected area. Warmth in the affected area can be a warning sign of a blood clot. This increased warmth occurs due to inflammation in the body's response to a clot blocking blood flow, which can lead to heat buildup in the surrounding tissues. Unlike everyday warmth resulting from exercise or environmental factors, warmth associated with a clot is often localized and may feel more intense. Being vigilant about this symptom is essential, especially if it accompanies other signs like swelling or pain. If you notice unusual warmth in your leg or any other area, don't ignore it. Seeking medical attention promptly can help ensure your health and prevent serious complications. Stay informed and proactive about your body's signals. Sign 5. Shortness of breath. Shortness of breath can be a serious complication of blood clots, mainly when a clot travels to the lungs, resulting in a condition known as pulmonary embolism. This can occur when a deep vein thrombosis breaks loose and blocks a pulmonary artery, leading to reduced oxygen flow in the body. If you experience sudden shortness of breath, especially if it's accompanied by chest pain or a rapid heartbeat, it's crucial to seek help immediately. This symptom is a medical emergency that requires prompt evaluation and treatment. Don't hesitate to call for assistance or go to the nearest emergency room. Recognizing the severity of this sign can be life-saving, so stay alert and prioritize your health. Sign 6. Chest pain. Chest pain can be a critical sign of a blood clot, mainly when it indicates a pulmonary embolism, where it travels to the lungs. This type of chest pain may feel sharp, stabbing, or like a heavy pressure, and it can worsen with deep breaths or coughing. It's essential to distinguish between different types of chest pain. While some may be related to anxiety or muscle strain, pain associated with a clot is often sudden and severe. If you experience chest pain, especially if it's accompanied by shortness of breath, dizziness, or rapid heartbeat, treat it as a severe symptom. Seek immediate medical attention, as timely intervention can prevent life-threatening complications. Stay vigilant and prioritize your health. Sign 7. Rapid heart rate. A rapid heart rate can be a significant indicator of blood clots, as the body responds to the presence of a clot by increasing the heart rate to maintain adequate blood flow and oxygen delivery. This response is particularly evident when a clot affects the lungs, leading to conditions like pulmonary embolism. If you notice your heart racing or beating irregularly, especially with other symptoms like shortness of breath or chest pain, monitoring your heart rate closely is essential. Don't dismiss these signs. They could indicate a serious health issue. Consulting a healthcare professional is crucial for proper evaluation and treatment. Being proactive about your symptoms can significantly affect your health outcomes. Sign 8. Lightheadedness or dizziness. Lightheadedness or dizziness can indicate a serious issue related to blood clots. When a clot obstructs blood flow, it can reduce the amount of oxygen reaching the brain, leading to feelings of faintness or unsteadiness. This symptom may occur alongside others, such as shortness of breath or chest pain, and should never be ignored. Take it seriously if you experience lightheadedness or dizziness, especially if it comes on suddenly or is accompanied by other concerning signs. It's crucial to seek immediate medical attention, as these symptoms could signal a life-threatening condition like a pulmonary embolism. Awareness of your body's signals and acting promptly can be vital for your health and safety. Recognizing the signs of blood clots is crucial for your health and safety. We've discussed 8 critical symptoms, including swelling in one leg, pain or tenderness, red or discolored skin, warmth in the affected area, shortness of breath, chest pain, rapid heart rate, and lightheadedness or dizziness. These signs can indicate a serious condition requiring prompt medical attention. We encourage you to stay vigilant and act quickly if you notice these symptoms. If you found this information helpful, please subscribe to more health-related content. Don't forget to share this video with friends and family and explore our channel for related topics to help you stay informed and proactive about your health.